So here we have an example of a left subclavian thrombosis. Here you see the flow, you see the thrombus there. It wasn't completely occlusive. There was a little channel of flow that was getting through there and going into the superior vena cava. So this is a young patient, no comorbidities, no vascular access lines at all. What would be a potential cause for this thrombus in a young patient? They don't have COVID. The answer is Paget-Shorter syndrome. Here you can see an example as the patient lifts their arms. The blood flow to the superior vena cava gets cut off, and it's caused by the compression of the clavicle and the rib. It'll compress the vein, the artery, and the nerve, also called thoracic outlet syndrome, and it's more common in males. So they get their diagnosis of DVT in the subclavian vein. They get prescribed anticoagulants, get sent home. In the next couple of days, they show up. Now they have shortness of breath and a cough. What would be your major concern? Pulmonary embolism would be your main concern. Here's you got a clot in the left pulmonary artery. Here's your main pulmonary artery and right pulmonary artery. Lastly, in this grayscale clip, you can see the thrombus and you can see some flow. You can actually see the contrast of the blood flow. What is the name of that phenomenon? The answer is rouleau or Rollo flow. It happens when the red blood cells get stacked up together. It's seen in stasis, hypercoagulable conditions, pregnancy. It's seen a lot in COVID patients. Could be a precursor for DVT.